Good day, everyone. My name is Shayma Kazmi. I'm a thoracic medical oncologist working for the Cancer Treatment Centers of America, and I will be discussing cancer care in the time of COVID-19, how we navigate lung cancer in today's new normal. So some of the questions that have been presented to me, and I'm sure all of you, is how are you managing your patients with lung cancer during COVID-19? One of the things we have to talk about is cancer in general, so that cancer patients are immunocompromised, and we don't clearly know how COVID-19 affects immunocompromised patients differently than immunocompetent patients. Although experience would tell us that our immunocompromised patients certainly have more risk of developing complications, we don't have enough data or numbers of cancer patients catching this disease, thankfully, to make specific determinations regarding diagnosis, treatment, and precautions. Lung cancer is unique in that a lot of my patients have respiratory symptoms to begin with, cough, shortness of breath. So really the bigger question arises, are these symptoms due to the underlying lung cancer, treatment and complications, or are these symptoms relating to this new disease, COVID-19? And the question really arises, who do I screen for COVID-19? How much time do I have to get these results back prior to making a treatment decision for this patient who has a life-threatening illness? Now, this is state dependent. Not all states have access to testing, nor do we have quick testing turnaround times as I promised, and those better tests are still coming in clinical judgment. So that if I know a patient who has chronic cough and shortness of breath, I'm not going to assume that's COVID-19 or stop my treatment. But obviously, if these are new symptoms, or I know if there have been exposures, or they're coming from a hotspot area, then screening is perfectly appropriate. The other answer we don't have is, should we do this routinely prior to a patient undergoing lung surgery where there's a high risk of exposure to droplets to everyone in the surgical suite and in the OR staff, and whether that's necessary. Some areas are doing it, some areas don't have the ability to do that. And so we'll keep our eyes on lots of larger institutions and organizations to give us some guidance as the weeks evolve and we have some more information about what the right thing to do is. What are your greatest concerns in standard care delivery outside of things like PPE? Certainly, I don't want to minimize my concern about lack of personal protective equipment for frontline health professionals. That's extremely important, not only to protect those health professionals from getting COVID-19 or exposure to the novel coronavirus, but also for me to protect my patients. God forbid I am a carrier and I'm one of those 20% of patients who are completely asymptomatic. So certainly my patients are at risk from us. And so it's really, really, really important that we have proper protective equipment for the frontline healthcare staff. The other concern I have is patients who travel to get their treatment sites, to see their doctors. They have to travel to the doctor's office, sit in a waiting room. They have to travel to an imaging center, a laboratory center. These are standalone places, and every place they go, touch, and expose themselves to, that's another area of exposure and possibly catching COVID-19. So how do we ensure that patients are safely doing this and minimizing some of these trips? For instance, I have foregone some of the interim lab tests that I would normally want to see on a patient that I initiate on chemotherapy. It's also patient specific, but I may say it's not worth you going to LabCorp request for the 2 interim labs just for me to see how your nadir is going. We have limited or no data really on how COVID-19 affects patients that are actively on chemotherapy or on immunotherapy or who are immunocompromised and how they ought to be treated. Do we prophylactically give them medications that may work for COVID-19? The answer right now is absolutely not. There is no data to support that. Do we prescribe medications such as hydroxychloroquine that may help patients who are admitted and very ill? Do we give these patients these medications when they're outpatient and relatively not as sick if they do have COVID-19? We don't know the answers to these, and a lot more information will be forthcoming when we gather that data. The other question that comes up with cancer patients is if somebody's getting routine 3 to 4 month scans, um, can we safely delay those scans? Do we really just need that CAT scan at 3 month interval, or really are we able to be flexible and make that 4 or 5 months? And I think it's, again, patient dependent, but a lot of my patients on surveillance, I am delaying scans to limit their exposure. Now, how much should we delay treatment? If someone's getting adjuvant chemotherapy for lung cancer that has been resected, we normally like a window of 4 to 6 weeks. Do we wait out 10 weeks, 12 weeks? Well, the question then arises of, do we really believe that our healthcare system and this epidemic will be under control in the next 4 to 6 weeks? And if so, it's reasonable. But we know from all the data that's forthcoming that this may be a long-lasting pandemic that's not going to suddenly resolve itself in 4 to 6 or 8 weeks. And if that's the case, then we know that indefinite treatment delay will absolutely affect these patients' morbidity and mortality. And when to start is really a decision between the patient and the physician that's involved. Surgeries, again, certainly cancer is not elective. So the cancer surgeries that we talk about, lobectomies and other things, are really important from standpoint of curtailing patient mortality with that disease. However, if, for instance, somebody needs a biopsy for genomic testing, would that be a perfect patient to consider liquid biopsies? And I would say in those patients, I am foregoing biopsies that require a procedure and doing the liquid biopsies. Certainly patients who need a port placement, for instance, does everyone routinely need a port placement? It's a surgical procedure, or can they go get by with peripheral access? So those things are important. Since these challenges are not one size fits all, the question is, what am I personally doing differently? My work routine is entirely different as most physicians, nurses, and healthcare staff across the nation. I am now wearing scrubs to work. So my professional attire has changed. And part of the reason is we know that the coronavirus can live on clothing for a period of time. So this way I'm able to take this clothing off and put it in a high heat sanitizing wash every single day without destroying my regular clothes. I put up my hair when I see patients so that there is no unnecessary touching of surfaces. I have no jewelry because I partly wash my hands so frequently. And we also have different methods of entry in our hospital. We have 1-point entry. Every single person, whether it be patient or employee, comes in with a temperature check, and we want to make sure that no one's coming in that's symptomatic without appropriate evaluation. We also have changed our daily meeting format. When we normally used to meet in one room and talk and look at all of the images on the screen together of patients, we're doing it now on Microsoft Teams, so that we are able to still see the same screen. The pulmonologist and all the other team members are able to look at the images of patients, but none of us are next to each other. We're also doing telehealth appointments in patients who don't necessarily need to be coming into the center and exposing themselves. So if somebody wanted to get blood work checked and we wanted to check in on their symptoms, and they're on oral therapy or they're no therapy and they're just being monitored, or they had imaging somewhere else and I can review those scans with that patient, we're doing telehealth appointments. I'm also wearing masks all day when I'm seeing patients. Again, not only to protect myself, but also to protect the patients in case I am an asymptomatic carrier. And frequent hand washing goes without saying. I'm also limiting my physical contact with patients on any given day unless a physical exam is absolutely necessary. For instance, if my patient has seen the pulmonologist today and has seen a thoracic surgeon, I don't necessarily need to do another lung examination on that patient, and I can forego that point of touch and limit their exposure. It's hard to not have physical contact with patients who are being sent home on hospice, who are emotional, they have um, worse scans, and they need to change therapy. We are realizing the power of the human touch and how much we miss it, especially in a profession like oncology, where holding a patient's hand at the time of giving bad news or giving them a hug has tremendous emotional benefit. We no longer have that ability to do so safely. And so I'm limiting that, and it's definitely a different feeling. When I get home from work, I leave my shoes in the garage and wipe down the car and the steering wheel with the bleach wipes and put the scrubs right into wash to limit my family's exposure. I have a nanny at home that's 66 years old, and she could certainly be at high risk of complications from COVID-19 if I brought it home to her. How are you managing work-life balance with new considerations like spouses working from home, children homeschooling, and shelter-in-place rules? So our life as we know it has completely changed. So what we have done differently in our home is certainly we are limiting outside food. We are trying to do some careful takeout options, supporting local businesses. We're able to help, um, excuse me, I don't want to cough in a COVID-19 presentation. Um, so having said that, we're really limiting outside food. So we're cooking a lot. We're cooking new recipes together and being very creative, which has been really fun. We're also taking advantage of nature, taking lots of walks. We have a 1-year-old puppy who certainly loves the walks. We're also establishing exercise routines on days where it's rainy and it's cold, and using the treadmill a lot more. The kids really do need to get their active energy going. What's difficult has been the homeschooling while I'm still going to work and my husband is working from home and is unable to constantly monitor the children and their progress. I have 3 children, and so we're doing is Zoom meetings with teachers and really trying to make sure we are establishing a schedule for them and some sense of normalcy for them while this is completely abnormal. The children are certainly unlimited technological rights at this time, and they're very happy being able to play video games with their friends, but that's their only social contact. So I am not limiting video games and other FaceTime and computer time for my children at this time. We also play board games, watch a lot of movies, and really try to stay home, all the time. What is one positive thing I'm taking away from this crisis? I have to say, we no longer have FOMO. My children love to use that word, the fear of missing out. We're no longer missing out on anything that's happening across our neighborhood or across the country, across the world. Our lives were truly overrun with too many activities and plans and sports and games, and there was a lot of rushing in my day-to-day activity, and there just isn't any more rushing. We are not running here and there. We have nowhere to run to. So life has certainly calmed down a whole lot, and we are calm. That's the one word I will say. We're more relaxed. We're actually speaking to each other, spending time together, getting to know each other in a deeper level because we have nowhere to go. We're in each other's faces. And that's been really, really meaningful and impactful. We're also asking the bigger question of life's purpose a lot more, when the whole country and the world is financially bereft and things are never going to go back to normal, not for a long time. Why do we do what we do? And was our life previously purposeful and really well-intentioned? So that's been a lot of the good things that have come out of all of this, and a lot of time for self-reflection. What is something important to you right now? I think one of the most important things I'm taking away from this tremendous pandemic is the coming together in my neighborhood with compassion and kindness. All of the people who are themselves financially affected and emotionally affected are reaching out to help others who are not as fortunate, and really find a way to fund the food pantry, for instance, find a way to make masks for the healthcare providers on the front lines, find a way to support each other's anxiety and fear without politicizing or without really breaking each other apart. That's been a wonderful thing to see, and it's going to become really important as we tackle this. One of the things I'm really passionate about is protecting all of the frontline healthcare staff, from the EMT that may first see a patient to the people who are cleaning the hospitals, to the food care workers in our local grocery stores. They really have been heroes in this process. We need to give them the respect, the compensation that they deserve. And certainly what's important is, how do I protect my family from this disease, my nuclear family as well as my extended family, and how do we stay financially abreast of all of this so that we can make this uh, an experience that's not going to forever scar us. So these are some of the important things I have. What are a few COVID-19 takeaways that you'd like others to know? This is for healthcare providers, and nothing that I will say will be brand new information, but we all know that this is a new novel coronavirus. It's highly virulent, highly infectious, and it's unpredictable in its effects on its victim, in the sense that certainly we know the older patients with respiratory illnesses are at higher risk of complications, but we also know that there's a significant number of young 30, 40-year-olds without any morbidities who've had severe complications and even death from this virus. So no one can truly say that they're safe and that when they get this, it'll just be a cold. I think it's something to take very seriously. Up to 20% of patients experiencing COVID-19 are asymptomatic, so it's really reasonable to assume everyone is infected and act accordingly with washing hands, social distancing. Flattening the curve also lengthens the curve. So while this may seem like it's going on forever, part of it is by design, so that it is not going to break the healthcare system. It may last a little longer, but we'll all get through it a lot better. And I always tell people who feel stuck at home is safe at home. And then you're really helping save lives by making sure that the healthcare system doesn't collapse. And the most important thing is, we will get over this. We will get through this. It will be hard. There will be consequences, but we will absolutely win over COVID-19. Thank you very much.